So next is, I will now move on. Next is the patient health questionnaire 9. So this examination, this tool, it talks about the severity of depression. Of course, this tool doesn't diagnose a patient with depression. So this tool will only measure if the patient is improving or not, if the depression is becoming worse or not. Okay? So the questions you might be asking is, do we need to ask all these questions to the patient? No. You only need to focus on areas of the PHQ-9 on the examination. Okay? So on the examination, this tool is pre-populated or it has been completed apart from the total score. What you're doing on examination is you're going to total the score of this tool and you're going to interpret it. So, so the one listed on your screen are the summary of the questions. But try to prepare what will be your conversation like. Let's say the patient has problems with appetite. So we've discussed malnutrition already. So you could use that health teaching to this patient. Let's say the patient on this page 9 is, let's say, the patient has thoughts that you would be better off dead or hurting yourself in some way. Probably if the patient, let's say the patient scored 3. So probably on your conversation, you have to explore more information with regard to this. Okay? The patient is thinking of, the patient has suicidal ideation. So you have to use your therapeutic communication to explore more information about this. Remember, when you're having a conversation with these kinds of patients, use open-ended questions. Do not use closed-ended questions. So closed-ended questions are questions only answerable by yes or a no. But open-ended questions are like, can you tell me more about it? You don't need to, again, you don't need to ask all the questions. You only need to focus on areas wherein the patient scored 3. And the most important thing is to interpret the result, which is on my next slide. So at the back of your PHQ-9, you will be seeing the interpretation. So 5 to 9, that is minimal symptom. The treatment recommendation should be support, educate, to call if first, and return in 1 month. 10 to 14, minor depression. Um, yep, so support, antidepressant or psychotherapy, antidepressant or psychotherapy, is that. And 15 to 19, that's major depression or moderately severe. So the treatment recommendation is antidepressant or psychotherapy. If the patient scored more than 20, that is major depression, and the treatment recommendation is antidepressant psychotherapy, and especially if not improved, on monotherapy. You have to have a good health education with the patient. So the one listed on your screen. So make sure to tell the patient that you're going to check the PHQ-9 regularly. So probably similar with your must, you're going to visit the patient after a couple of days. Okay, after a couple of days, most especially if the patient is scoring very high. Okay, most especially if the patient is scoring very high. Again, there is no right or wrong on when to actually visit the patient. If you go back to 5 to 9, it says they return in 1 month. But for the succeeding scores, there is no exact date on when to visit the patient. Again, it depends on your critical judgment, okay, or your clinical judgment. So make sure when you're dealing with the scenario, you have to emphasize medication compliance. If the patient is already on antidepressant, family, if it's relevant, okay. We all know the support from the family. It's also vital for depression. Psychotherapy, of course, is written there. Your therapeutic communication. And the most important thing is, for this scenario, is the referral to community mental health team. Okay? So make sure to say to the patient that you're going to refer the patient to the community mental health team on the examination. Oh, there's a question. Just to clarify, with MUS and PHQ, does this come with news too? That's a good question. So for the old test of competence, I don't know what's on my next slide. Sorry. Okay, we're nearly done. So if you're doing the old examination, the pairing would be the news will be on its own. Okay? On the old examination, the news will not be paired with anything. Same goes with GCS. It will not be paired with anything. Okay? If you're in the community, you will be using the TPR, and the TPR will either be paired with must or the PHQ-9. Okay, so that means the must and the PHQ-9 will be intended for community scenario. Yeah. So for the new OSCE, the news might be paired with PHQ-9 or the news might be paired with must. But the GCS will be on its own. How's that, June? I hope I answered your question. Polina, she's asking, how do the PHQ-9, how to do the PHQ-9? Oh, you mean the document? So the PHQ-9, go back to here. This one again, it's pre-populated. There are answers already. Again, your task is to just total the score and interpret the result. If you want to ask follow-up questions with the patient with regards to the scoring, you only need to focus on the questions wherein the patient scored higher, let's say threes or twos. Okay, because you don't have the eternity of the time, or you don't have the luxury of time to discuss everything. Yeah, I hope I answered your question, Polina. Yeah. All right. Thank you. She's happy. All right, let's carry on. So now this will be the end part of our webinar. Okay, so just let me know if you have question. Okay, so we will be covering the criteria on how to pass the examination. So the criteria that I will be showing only for the new test of competence. So why, Emma, are you not showing the criteria for the old test of competence? Because it's basically the same. Okay, it's basically the same. And the new test, the new marking criteria has more information as compared to the old test of competence. But basically, you're basically doing it on the examination. Yeah, that's that. Just let me know if you have any questions. So I will be pausing per slide. So the first criteria is scene safety. So when you're doing this task, you just need to verbalize that the scene is safe. Okay, that there are no trips, slips, and fall hazard. I'm happy to proceed. Yep. So that is your scene is safe. This also applies on the old test competence. On the new marking criteria, it says there to provide here to provide privacy and dignity for the patient. So on your examination, you will be performing your examination on individual rooms. Okay, on individual rooms. So most likely, the door is already shut. So when you're doing this part of the criteria, you just need to mention that you're going to provide for dignity and privacy of the patient. Okay, you only need to verbalize it. You're not doing anything at all. You are not drawing any curtains. You're not closing a door because the door's already shut on the examination. Yeah. Any question with this criteria? So before we move on, I think Arian has a question. News two, in your example a while ago, is it safe to answer hourly instead of 4 to 6 hours, regardless of the news score? So we'll follow our clinical. Yeah, depending on your judgment. Because remember, if you go back to the news, that is the minimum. It's not the maximum. Okay? So you can always use your clinical judgment, but make sure to explain to the patient why are you doing such action. Okay? That's the only thing. You have to explain why. Let's say, oh, I'm concerned about your breathing. Even though your score is low, I want to go back and check after you after 1 hour. Okay? So that's also valid in the examination because you're demonstrating that you are a safe nurse. Okay? So that is the point of the examination. So let's carry on. Sorry, I can see a lot of questions. Let's answer at the after we finish all the criteria. Any question for CineSafe? Yep, happy with that? All right, we're nearly done. So hand hygiene. So the one on your screen are the steps of the hand hygiene. On the examination, you're only washing your hands using a hand gel. So you're basically performing a hand rub. The steps are, so palm to palm, right palm of the left over the left dorsum, and then on the other hand as well, palm to palm with fingers interlaced, back of the finger, of course, and then on the other arm as well, hand as well. Next is the thumb, and then the rotational rubbing backwards and forward with clasp finger on the right hand, and then let it dry. So on this picture, it doesn't show that that you have to wash your wrist. Can we do it on the examination? Of course. The tip for this when you're doing this is from now on, probably whenever you wash your hands, you start performing the hand hygiene properly under the WHO guideline. Okay, so the 8 steps. Whenever you wash your hands, do this. So by the time you do your examination, this one will be easier for you. Okay, so Emmer, the question: do I need to say the steps while performing it? No. Okay, you don't have to say the steps whilst performing it. Just do it. Remember Nike's slogan? Just do it. Okay? Remember that. Why? Because the assessor can see you performing it. And the most important thing you have to remember again for hand hygiene is the 5 moments of hand hygiene. So before the patient contact, before aseptic task, after patient contact, after body fluid exposure risk, after contact with patient surroundings. Probably the next question is, Emmer, how many times are we going to wash our hands on the examination? So basically in the examination, you are not leaving the patient. Yep, you're in one patient only. So probably before patient contact and then after patient contact. Can you also do hand hygiene in the middle, in between, of course. Probably you can also wash your hands before and after you perform the observations. So hopefully, Mark, I answered your question. You don't need to say the steps. Yeah, you will pass without saying the steps. So during Polina, during the 5 moments, do we have to do the whole steps of hand hygiene? Mean the whole step, of course, because it will not be a proper hand hygiene if you're not following all the steps. Yep. So going back to the PPE on my first few slides, you will be performing it with your gloves on. Okay? You will be performing your hand hygiene with your gloves on. So the assessor will tell you to not put the hand gel on you because it's silly putting the hand gel and then washing your hands with your gloves on. Okay? Again, it's just to protect the actor. So the assessor will tell you just pretend you're washing your hands without the gloves. Okay, so that's why on our video, you can see my colleague Coco, she was washing her hands with the gloves on. Okay, so it's just pretending that the gloves is not there. Okay, the next assessment criteria is to introduce yourself. So whenever introducing yourself, make sure your name, your role. So my name is Emmer, and I will be your nurse for today. The reason of your visit. So probably I'm here to do some assessment. I will be doing your A3 assessment, or I'll be taking your observation, and I'll be asking you further questions towards the end. Okay? So that is your introduction. Any questions? So this one is straightforward. Identify the patient correctly. So whenever you're identifying the patient correctly, make sure that the following information on your screen are correct. Okay? Or it is same on the patient's ID band. So on the old test of competence, you will be seeing the patient's addressograph on the admission booklet. Yep, can you remember that? It's there. So you have to counter check that with the patient's ID band. And you have to check the following: the full name, the date of birth, and hospital number. So whenever you ask for this information, you have to ask the patient, could you please tell me your full name? Okay? Do not supply the information to the patient, because you can also ask this: is your name Emmer Diego? Is that correct? The answer, the patient will just tell you yes or no. So that is wrong. That is the way wrong. That's the wrong way of doing it. You have to ask the patient, could you please tell me your full name? Okay? Because what if the patient is confused? The patient could just tell you yes or no. Okay? So the patient could assume a different identity. So make sure to ask the patient what their full name is. Similar with the date of birth. Okay? And make sure to check the hospital number. We had a fail. I just want to share it to you guys. One of our candidates failed this because of this. The patient, our candidate or our nurse failed to counter check the patient's ID band with the existing document. I'll give you this one. So this one is only applicable for patients or scenario in the hospital. Of course, in the community, you are not expecting to see patients wearing ID band. Is that correct? At home, you don't wear ID bands, yeah? So the other question that you could ask the patient is the address. Of course, the patient would know their address. Okay? That's the other question that you might be asking for the patient if the scenario is in the community, because you are not expecting to see any ID bands. Okay? Because you don't wear ID bands at home. So next is allergy. So allergy and reaction. So remember what I mentioned earlier, if the patient is allergic to a drug or anything, and most especially with drugs, keep an eye on that because it might appear on the implementation station or the third station of your API. So make sure you ask the patient, do you have any allergies to food, drugs, or latex? And make sure it's similar with your information from the admission booklet or from the patient overview. Any question with allergy and reaction. So for the old test of competence, um, make sure that you take note of the reaction because you will be writing that on your evaluation letter. And also, it applies also for the new test of competence because you will be handing over this as part of your S bar for your evaluation station. Polina, she's got a question. After asking the name and other details of the patient, are we supposed to read again the details of the patient, or is it okay to say, yeah, that's fine. You can just say that I confirm that I have the correct patient. You don't have to read it back again because it will consume a lot of time. Just probably, normally what you do is, whilst the patient is telling you the information, let's say allergy and patient's name, you're looking on your document already. Yep. Is that a good tip? Next is gain consent. So this one should be easy. Of course, it applies not just for assessment, but for all the stations, excluding stations with writing. Of course, you have to ask the patient if it's all right, or are you happy for me to proceed? Okay, so that is how you gain consent. Of course, you cannot proceed any interventions or any actions if the patient doesn't consent to it. So this particular assessment criteria is not part of the old examination. This one is clearly written on the new test of competence. So of course, use a calm voice. The speech is clear, body language is open, and personal space is appropriate. Do I need to explain it? Of course, you know it. But the only thing that I need to highlight with this criteria is some of the candidates, they are murmuring on the examination to the point that the assessor cannot understand what the hell you're saying. So one of the red flags for the task of competence, if you might fail the examination if the assessor could not hear whatever you're saying. Remember on the examination, you are talking to an actual person, but always remember that the actor is not the one marking your examination. Okay? Always remember the actor is just there to act. The actor will not be marking your examination. So whenever you talk to the actor, make sure your voice is loud and clear that the examiner could hear you properly. On the examination, because of COVID, again, as one of their protocols, they are not going close to you. The examiner will will maintain their distance. Normally, I think like candidates are saying, the examiners are only standing on one corner of the room, and then you will be on the other end. Okay, so make sure your voice is loud and clear. So this one is the A2E assessment. So I hope you've watched the video. I won't be playing the video anymore because our video for the OSCE is like 16-minute long. So you can always access those videos on my YouTube channel. So hope that is useful. So for airway, you only need to verbalize that the patient's airway is clear and no visual obstruction. Ask the actor to cough or take a deep breath. Okay? So that's the only thing. After that, you can just say that the patient's airway is clear and there is no visual obstruction. How's that? Let's move on with breathing. So these are my lovely colleagues, Jamie and Coco. You've seen them on our videos. If you haven't seen it, please do watch our videos. Um, so on the marking criteria, of course, respiratory rate is part of breathing. But because you don't want the patient to be conscious that you're counting the respiratory rate, you can perform it when you perform the pulse rate. Okay? That's why I put there best assessed together with pulse rate, because we don't want the patient to be conscious that we're counting the respiratory rate. So just the only thing that you have to remember when you're counting the respiratory rate, it should be counted for 1 full minute. Okay? 1 full minute or 60 seconds. Okay? That's that. You know how to count the respiratory rate, so I won't be showing you how to do it. Oxygen saturation. So what's the most important thing that you have to remember when you're doing oxygen saturation? You have to check the finger first for any signs of inflammation, infection, any surgery before putting the probe on the patient's finger. Yeah? So oxygen saturation is pretty much easy. So next is respiratory noises. So make sure, guys, you do your self study on what the respiratory noises are. Let's say wheezes, crackles, stridor. You know what it sounds like. Next is to check for equal or unequal air entry. So if you can see on the picture here, you have to put your hands on the patient's chest and ask the patient to take a deep breath and check for equal or unequal air entry. Okay, so that's that. And lastly is the visual signs of respiratory distress. So you only have to verbalize that the patient has no signs of respiratory distress. What are those? Probably like sweating, seesaw breathing, the use of accessory muscle, cyanosis. Next is circulation. So pulse rate. So when you do your circulation, you will tell the assessor, I will now perform my circulation. So of course, you have to check the pulse rate. So the pulse rate, we all know how to do it, yeah? So on the examination, you will be checking or palpating the radial pulse. We all know that we have different pulse sites, and the most accessible is your radial pulse. So when you're checking for the pulse, what do you need to take note of? The quality, the rhythm, and the rate, of course, of the pulse. Okay, for 60 minutes or 1 full minute. Okay, and after that, you will continue with another minute to check for the respiration. So that is because we all know the reason behind that. It's for the patient not to be um, conscious that you're counting the respiratory rate. So that should be easy. So blood pressure, for the blood pressure, of course, so we all learned from our textbook before that the left arm is the most probably ideal site of checking the blood pressure, but that's not the case here. Okay, make sure you use the arm. So make sure you assess the following before you perform your blood pressure. If the patient has any surgery on the arm, if the patient has any fistula, we all know what a fistula is. If the patient has any inflammation, um, or pain on the arm before using it. That's the only thing that you have to consider before performing the blood pressure, okay? And if the patient is well rested, and make sure you choose the appropriate cuff size because we know the reason behind that, yeah? So that is for the blood pressure. So definitely on the examination, you're using an automatic a machine to do this. You are not using the manual blood pressure. Okay, you are using a machine similar to the machine that you've seen on the video. On the examination, you will be using a Dynamap. That's the brand that you're using on the examination. So on the examination, before you start, the assessor will give you time to play with your machine. Grab the chance to play with the machine so you know how to use it on the examination because in different trusts, we use different brands of blood pressure machine. Okay. So on the examination, the brand that they're using is the Dynamap. Capillary refill. So for the capillary refill, what's the most important thing to remember when performing this? Make sure it should be placed on the patient's heart level. Okay? So make sure to lift the patient's hand or finger. It should be leveled with the patient's heart. When you perform capillary refill, we don't press the nail bed anymore because that is painful. We press the side of the finger. That is more painful as compared to pressing the side of the finger. You will still get the same result. You will see if the color of the finger will go back to normal. So what's the normal capillary refill? It should be less than 2 seconds. So you have to press the finger for 2 to 5 seconds. Okay, you need to wait for 2 to 5 seconds. 4 seconds, yeah, 3 seconds, 2 to 5 seconds. Yep. Question in terms of capillary refill. I hope I made it clear. So next is pallor and perfusion. So for pallor and perfusion, you only need to palpate or place your hand on the patient's upper and lower extremities to check for any cyanosis, for the temperature. Remember, there might be patients wherein the temperature on the upper limb is different to the temperature of the lower limb. So that might signify that the perfusion in the lower limb is poor as compared to the upper extremities. Okay, so on the examination, it says on your briefing, you don't need to expose the patient. You don't need to get rid of some of the patient's clothing to perform this. On the exam, the legs are already exposed. Next is disability. So disability for criteria 8D, so we have the ACVPU. So Emmer, do we need to perform the full GCS for ACVPU? No. If the scenario is not about GCS, then you don't have to perform it. So what do we need to perform actually? You only need to verbalize that the patient is alert and orientated. Okay, but on my next slide, I will be showing how to perform the GCS. Next is pain. So I've discussed pain already earlier on my previous slide. So pain, if there is a presence of pain, the score, the quality, and the location. Those are the only questions you have to ask the patient. You don't need to perform the PQRST because it's a standalone station. Okay? You will be assessed on this station separately if this will be your examination. Okay? Urine output, you could ask the patient, um, what's the last urine output, or if they have any problems with urination. So the scenario that you might probably focus on with regards to urine is heart failure. The patient might have problems in terms of urine output. Okay, know what diuretics are. So in the UK, normally people will call it water tablets. Okay, so they're referring to diuretics. Just remember what are the most important thing you have to remember as a nurse when you're dealing with patient taking diuretics. Okay, so blood pressure, frequent urination. The next is blood glucose. So Emma, do we need to perform blood glucose? Normally on the examination, you will ask the assessor, what's the what's the current blood glucose level. So in the UK, we use millimoles per liter. In the UK, the normal range of blood glucose is 4 to 7 millimoles per liter. Your conversation will be dependent on the patient's blood glucose. So hopefully you know what to say to a patient with a high or low blood glucose level. Okay, so that is your disability. So assessment criteria 8D, the neurological observation. Eye response. So you just need to verbalize that the patient's eye is opening spontaneously. Okay, we all know that for eye response, the highest score is 4. Okay, we agree with that. The highest GCS score would be 15. Okay, and the lowest would be 3, not 0. Okay, 3. So eye response is 4 out of 4. For verbal response, you need to identify that the patient is orientated with place, time, and person. So for person, you could ask the patient, do you know who am I? Alternatively, you can ask the patient, do you know who you are? Alternatively, you could ask the patient, do you know who the queen is? Make sure you ask a question which is a common knowledge. Okay? So you only need to question with regards to person. Place, of course, that's easy. Do you know where you are? And date or the time, do you know what day of the week it is now? What time is it now? So those might be your question with the patient. So person, place, and time. So that is that. So that is your verbal response. The highest score would be 5 out of 5. Next is the motor response. So for the motor response, you might be asking the patient to perform the following commands. So smile, frown, puff the cheeks, raise the eyebrows, stick the tongue out, and a thumbs up. Okay? So that is for your motor response. So these are the commands that you will be asking the patient to perform. So next is pupil size. We're not done yet. We're nearly done. So of course, the pupil size, you have to compare the pupil size on your paper. Remember the GCS chart? On the side of the GCS chart, there are circles. Okay, there are circles. So you could compare that with the patient's eye. Alternatively, you can use the pen torch. The pen torch is present on the examination. The side of the pen torch is had circles. You can compare it on each eye. Make sure to compare it on each eye because we know that probably the left might be different to the other one or the right. Okay, that is your pupil size. And the pupil reaction. When you shine the light, it should be from outer canthus to inner canthus. Okay, always do it on both with both eyes. Okay, and you have to take note of the reaction. Okay, what are the reactions, Emmer? It's the dilatation and the constriction of the pupils. Okay, so that is your pupil reaction. And lastly, for the GCS, is the upper and lower limb strength. So you have to ask the patient to put both to put both arms up, and you will put resistance and ask the patient to resist. Okay, and check the strength of the arm. Same applies with the lower extremities. So probably for the extremities, because it's difficult to raise both feet at the same time, probably ask the patient to raise one at a time. Okay, and then you apply pressure and then check for the strength of the legs. So that is your GCS. So exposure, the last part of your A2E assessment. And also E stands for everything else. Okay, so exposure, ear, temperature, tympanic temperature, and it's everything else. The things that you haven't done yet. Okay, so You might be asking you can ask the patient, do you have any bleeds, rashes, injuries, or bruises? So what scenario do you think this might be applicable? So this might be applicable to scenarios such as fall and fracture. This might be applicable to subdural hematoma. Remember, if the patient had a fall, they might be presence of um, bruises or injuries. So you only need to ask the patient. Or sometimes you could ask the assessor, um, could you please let me know if there are any bleeds or rashes um, present to the patient. Okay? So that is your option in the examination. And obtain a medical history. So this might be the section, I think somebody asked this, when to read the document. This might be the section wherein you're going to go back to the patient's complaint and medical history if you want to know more about the patient's history. Okay? So it's the rest. Okay, if you want to discuss anything with regards to the patient's current condition, it's this part. Okay, it's the everything else. So any question with regards to E, that's the end of our A2E assessment. So for the old OSCE, this one is easier. For you guys who's doing the old OSCE, these are the only things you have to perform. Temperature, blood pressure, oxygen saturation, pulse rate, and respiratory rate. So just temperature, make sure, guys, you check the ear for any signs of infection, hearing aid, inflammation, and infection before putting the probe on the examination. Posing the probe, guys, for temperature, you put it in the appropriate bin, the yellow bin. Candidates failed the examination because of disposing the probe on the wrong bin. One of the candidates disposed the probe on the black bin. We all know that the black bin is only intended for domestic waste. Okay? Anything, any articles that you consider um, infectious or items that come in contact with the patient, make sure to put it on the yellow bin. So assessment criteria number 9, wherein most of the candidates are failing the examination because of not accurately measuring and documenting vital signs and specific assessment tools. So yeah, so make sure to perfect your new start, your GCS, your MUST, your PHQ-9, or whatever tool you're being asked to complete during your assessment station. Okay? To calculate news or GCS accurately, of course, again, I've mentioned this already. If you still have, guys, on the examination, if you still have 2 or 3 minutes left on your 20 minutes time, or let's say you have 1 minute left for the old examination, use that minute, those remaining minutes, to check your documents, okay? Because it might be the crucial point of your examination. All right? Always remember that. Complete document, whatever document that is. And the number 12 is conduct a holistic assessment relevant to the scenario. So it's the everything else, okay? Anything else you want to discuss with the patient. So on the examination, the actor will lead you to the conversation. Let's say the patient is, let's say, anxious. The patient or the actor will say that. They say, oh, I'm concerned about my family and my friends. The actors will lead you to the conversation. What are they most concerned about? Okay? So if you ask the question, do you still have any concerns? The actor will tell you. And make sure to respond accordingly. I'm saying, oh, nurse, I'm afraid I'm dying. The nurse will then respond, let's talk about your smoking. Okay? So guys, please do not dodge the conversation. You respond appropriately to the patient's concern. Make sure to show the 6 C's of nursing. Okay? And I think this is my last slide. Make sure to dispose your equipment appropriately. Going back to the PPE, that you are not removing your PPE until the actor is gone. Okay? So the only equipment that you're disposing is the probe. Okay? That is the only thing that you're going to dispose on the examination. It's just the probe. The assessor, again, will tell you not to remove your PPE until the actor is gone. Okay? So you are washing your hands at the end of the station with your gloves. And lastly, to act professionally throughout the station. I think that ends the first webinar for today.